Hi, Gary. This is Chris Marchack. I'm a prosthodontist in Pasadena, California, and I am the host of Clinical Chats in the I Love Dentistry Facebook group. It is a true pleasure for me to share another clinical tip with all of your listeners, and I'm so excited that these clinical tips help your listeners worldwide. I'd like to share a tip with all of your listeners today that was shared with me by my really dear, dear friend, as we would call it, my brother from another mother. He's also a prosthodontist in the 450 Sutter building in San Francisco, which you may know as one of the buildings that houses the largest number of dentists all in one building. His name is Dr. Tom Zhao. Tom has always mentored me with efficiency in my practice, how I plan my time with a patient during the procedure. It's funny, it's really interesting. He has figured out how long it takes to do every step in a crown preparation procedure, from the time it takes to give an injection, the time it takes to talk with the patient, to consult with them and make them comfortable, to preparing the tooth, doing buildups, how fast it takes him to place the cord around the tooth for the impression, and even provisional fabrication. Now, how long it takes him to do that. Bottom line is that patients want to come in and get the thing done and get it out and get out of the office. They don't want to have to wait around in the office as much. They too want us to be very efficient with our time. What made the biggest difference in my practice and my efficiency and how I do my procedures was his tip to me on how to fabricate a provisional crown and what to do. Now, I know that many doctors have their chairside team member make their provisional crowns, but you may call this old school, or I'm very particular about my provisional restorations, and I know that there are many out there who still do their own provisional restorations. This technique, I can say, really makes things very efficient. With this technique, I can complete the process in less time than it takes for the dental scan to be completed or even the impression materials to set. In essence, it takes me less than 5 minutes to fabricate the provisional restoration. In that treatment sequence, after the tooth preparation, I will fabricate the provisional restoration, and very typically with one of the BIS GMA materials or self-cured composite resins. Typically, I would use some type of matrix such as an impression or a plastic index, something of that sort, so I have a rough idea what the tooth looks like. And after I prepare the tooth, I would typically in past make the impression immediately or do my intraoral scans and then fabricate the provisional restoration. And then I would excuse myself and head to the laboratory to trim the provisional restoration. Well, usually when I head to the laboratory, we will take a short break, have a cup of coffee, get something to eat, start talking, or even taking phone calls. And there was a lot of wasted time. He says, Tom told me, he says, you got to really get out of that habit. Stay in the operatory. You got to stay in the operatory and do it and be efficient with it. So that was a big change for me. So after I prepared the tooth, I would go immediately into fabricating the provisional restoration with the index. After the material's set, I would then clean the tooth and immediately make my impressions. While the impressions are setting, I will then start to begin to trim the provisional restoration. Now, instead of using a straight handpiece in the operatory, one of the things dentists work well with are high-speed handpieces. And what I found is that I can quickly trim my provisional restorations with a high-speed handpiece with water to cool. and using the high-speed evacuator to suction the water and the spray, I found that using the high speed and a diamond burr, I have greater control. It is faster to cut and cleaner to cut the composite resin than a straight handpiece and a carbide burr. And using water helps prevent clogging of the diamond burrs with the composite residue. After trimming the provisional restoration, I will then use the traditional polishing wheels that I use intraorally after a composite resin restoration. I would use those polishing wheels and polish my provisional restoration. Um, and this underwater gives us a really high or ultra high shine, a mirror finish and texture. And with such a smooth surface, we have great soft tissue